My name's Chastity Spencer. What is your name?
My name is Ron Taylor.
How are you doing today, Ron?
I'm doing just fine, thank you.
Okay, so my role as a counselor is to listen to you without any judgment. I won't force you to talk about anything you don't want to discuss. Some expectations I have for you are to be active in participation, have self-responsibility, and be honest. There are going to be a set of goals and objectives to follow. Are you willing to participate?
I'm happy to do that.
Okay. So to begin with this diabetes counseling, we need to set objectives. And the type of objective I would like to cover with you is physical activity. Is this something you are willing to do?
Yes, it is.
Okay. So why don't you tell me why you're here today?
Well, I think I'm interested in getting motivated to get back into a good exercise program. I'm a diabetic, so exercise, as you know, helps bring my glucose numbers down, or diabetics' glucose numbers down. So I used to exercise a lot, but I don't do it anymore. So that's my reason for seeing you.
Okay, so tell me what you know about type 2 diabetes.
Well, there's type 1, which requires insulin shots, I think. And there's type 2, which could be controlled with diet, weight control, and exercise, and taking the meds that you're prescribed. So I would say that if I get my weight down through exercise, my glucose numbers will come down, and I quit medications.
So describe to me your concerns about type 2 diabetes.
Describe to you what?
Your concerns about having type 2 diabetes.
Well, it isn't a good thing to have, because it can get into other problems like eyes and heart and kidney functions, and if you don't control it. So I'm not sure about circulation, but does it?
Yeah.
Okay. So those are my concerns. I don't want to go through all of that, but so I want to get into a good exercise program.
So how are you managing your type 2 now?
Well, I have lost about 5 pounds, but it's stopped for whatever reason. I take my medications, but my numbers are still high. They run at about 175 to 200, which is too high. So I need to get them down from 90 to 110 or 115.
Okay.
That's my goal. That's what I want to do. That's what I'm motivated to do, and I want to do it with exercise.
Yes. What do you see yourself doing to lower your blood glucose levels?
Well, I have to watch what I eat. That's I'm real careless about that, because some people, they make ice cream, or they drag me out for ice cream, and I have no self-control, and I eat ice cream with them because I don't want them to feel by themselves. So, but I'm just kidding about that. But really, I have to watch what I eat, and I have to watch my diet, and try to keep the carbs and down, unless they're good carbs, and sugar's out. No more sugars. Nothing with sugar in it. Or maybe some oils too, I'm not sure.
How do you feel about having type 2 diabetes?
Well, I don't like it.
Because?
Well, it's life-threatening, and it requires a discipline to keep on top of it, and I don't seem to do well in controlling it. I did for a while, but it kind of got away from me. So to answer your question, how do I feel? But I dislike it a lot. But it is what it is. You can't get rid of it.
So I'm going to tell you a little self-story. I understand the effects of having type 2 diabetes. I have family history of diabetes. Both my grandparents had diabetes. They were both on medications, and they didn't exercise as they should and didn't watch what they ate. And later on, gaining weight, and that took a toll on their health. So if I might ask your family about your type 2 diabetes, what would they say?
Well, I don't know. They were farm people. I think they used to call it having sugar. I think there was diabetes on my mother's side of the family, but I'm not sure of that. My dad wasn't a diabetic. I don't know about my mom. I think she died at an early age, so probably didn't have a chance to become a diabetic, if that was a possibility. I heard my grandmother on my mother's side talk about having sugar. That was, I was just a kid, and so it didn't have much meaning to me. How do you have sugar? When you're 6 years old, you hear this. So that's it. That's all I know about it.
So the goals we want to be aware of is to control carbohydrate and sugars in diet, stay away from starchy foods and sweets, and start a food diary. So the objective we're going to cover is by the end of the counseling session, you will construct a physical activity plan based on American College of Sports Medicine or American Heart Association guidelines. So what that means is getting, I don't know, okay. So a type of exercise that you are interested in is walking.
I'd like to start off, walking. I'd like to start off with, 30 minutes. That should be pretty easy for me. And then an hour. And after I get up to an hour a day, and my weight goes down because I'm exercising and I'm watching my diet and what I eat. I would like to increase the mileage or the time or both, and maybe even start a little jog.
So some information I can give you according to American Heart Association is getting at least 150 minutes of exercise per week, moderate intensity aerobic activity, so walking, or 75 minutes a week of vigorous activity like jogging or running. Preferably spread throughout the week, like 30 minutes for 5 days. And of course, this lowers your risk of heart disease, stroke, type 2 diabetes, high blood pressure, dementia, and Alzheimer's, and losing weight